Okay. Hi, everyone. I just wanted to begin by briefly mentioning how exactly I landed on this topic. So I'm a political science major, but I'm pre-med, and I've considered possibly becoming a plastic surgeon in the future. So I wanted to use my bachelor's essay as a way to really merge those two interests and passions. So I've decided to delve into the ethics of cosmetic surgery and to examine those ethics through the lens of two different political theories of justice. So first, I just want to make sure we understand what exactly cosmetic surgery is and isn't before we move forward. So plastic surgery is a broader term that can be used to describe any procedure focused on the reconstruction or the alteration of a patient's body, and this can be broken down into two categories called reconstructive surgery and cosmetic surgery. Reconstructive surgery is focused on the restoration of a normal appearance or normal function following disease or injury, and an example of a reconstructive surgery might be the repair of a cleft palate or a rhinoplasty, a nose job in the case of a deviated septum to restore breathing. In contrast, cosmetic surgery is focused on aesthetics. It's focused on changing or enhancing a patient's appearance with little regard with function. So some examples of those can be seen on this slide, and that would be that same nose job I just mentioned, but done for the purposes of reshaping the patient's nose rather than restoring any kind of diminished breathing. And I've chosen to focus on cosmetic surgery specifically for a couple different reasons. In contrast to reconstructive surgery, cosmetic surgery is generally considered medically unnecessary and is not covered by insurance. And there's also lots of negative public opinion surrounding the cosmetic surgery industry and patients who choose to get these procedures. We oftentimes think of them as vain or narcissistic, and we sometimes think of this industry as being outside the purview of medicine in some ways. So even though we have this negative public opinion, lots of research has shown that patient motivations for getting cosmetic surgery relate not directly with their appearance, but with what I will call psychosocial decline. So these individuals are experiencing some kind of suffering or distress related to their appearance. They might have very low self-confidence, they might feel disinclined to appear in public around their peers, or they might have trouble forming various kinds of social relationships. And research has also shown that cosmetic surgery does effectively restore these people back to a baseline level of mental health and allow them to function in the world the way they want to and to flourish. And so the ultimate goal of this project, then, is to investigate how two different political theories of justice, called capabilitarianism and resourcism, might argue for different cosmetic procedures to be considered medically necessary. And I think this project is so relevant and important currently because this industry is extremely popular. In the US, we perform millions of these surgeries annually, and we spend tens of billions of dollars on this industry. And these numbers are only growing each year. And if we change the way we think about medical necessity in relation to cosmetic surgery, this can have lots of wide-ranging implications on policymakers, the insurance industry, individual surgeons and patients, and just the general public as a whole. So now, moving on to my methodology, I decided to apply these theories to the ethics of cosmetic surgery by creating a series of hypothetical scenarios. And in these scenarios, I'm varying different factors like age and gender to determine the kinds of circumstances that sway determinations of medical necessity and to figure out what kind of factors might push a surgery over the threshold into being considered medically necessary. And these kinds of scenarios are very common in the study of ethics and bioethics to investigate different ethical dilemmas. And so now, just given time constraints, I'm only going to go into detail about one of my scenarios, which is called Scenario 2. This scenario concerns baby Erin, who has just been born, and doctors discover they are intersex, with ambiguous genitalia having both male and female characteristics. So now, Erin's parents are faced with a decision regarding whether Erin should undergo what is called infant genitoplasty to give their genitals a uniformly male or female appearance and thus determine their gender moving forward. And so before I applied my theories, I had lots of different questions and ideas I wanted to make sure I addressed. One of those was the idea of changing norms. So historically, this kind of procedure was widely accepted within the medical community and was routinely practiced in these kinds of circumstances. And only recently, in the past few years, have some parts of the medical community come out to condemn this practice. And this is due to lots of cultural and social shifts in how we're thinking about the sex and gender binary. So today we're asking questions about whether intersex individuals should be considered as having a kind of medical pathology that warrants surgical correction, or if they should be considered as another legitimate, valid, and accepted form of human presentation that fits within the spectrum of human sexual dimorphism and thus doesn't warrant any kind of intervention. I also wanted to think about what you might do in a case where there's lots of unclear benefits and harms associated with both intervention and non-intervention. So currently, we don't have the best understanding about the kinds of mental health issues that intersex people experience as it relates to their being intersex. And we also have conflicting evidence about the kind of impacts these surgeries have on individuals. We have research that shows lots of benefits resulting from these surgeries, where individuals are very pleased with the results, they wouldn't have it any other way, and they're happy that they've never had to experience any kind of harassment, bullying, or discrimination as it relates to their being intersex. In contrast, we also have research that shows various harms from these surgeries, like permanent incontinence, painful scarring, and reduced sexual sensation that is irreversible. And so now you might be thinking what you might do in this case when there's lots of conflicting ideas at play, and this is when I began to apply my ethical framework. So now I'll give you sort of a general overview about these two political theories. So resourcism, like its name suggests, is about resources. They want to think about the kind of rights and goods you should give to people to establish a kind of level playing field within a population. They want to think about bundles of things to give people to create equality of opportunity. Capabilitarianism is focused on capabilities, which just refer to the kind of ability or capacity of individuals to secure their own well-being. And so in these kinds of cases, these theorists are focused on asking questions about whether the psychosocial decline associated with one's appearance does meaningfully diminish their equality of opportunity or does diminish their capabilities. And likewise, if cosmetic surgery can then be thought of as a legitimate way to reestablish that equality of opportunity and reestablish those capabilities. And so in Erin's case, their genitoplasty was considered not medically necessary because of a lack of overwhelming evidence regarding the kind of benefit this intervention might have. So the best case would just be to wait and see what Erin maybe wants to do when they're 18 or 21 or much older. And so now, zooming out to think about the wider results of the project as a whole, with all scenarios I constructed considered, there were various points of agreement and disagreement among the theories. They both agreed that age and the idea of norms play a really large role in these kind of determinations. And because age and norms are subject to change and shift, these determinations are not absolute and will change along with those shifts. And ultimately, in 2 out of the 3 sets of scenarios I created, both approaches reached the same conclusion regarding medical necessity, but did so with very different reasoning. So resourcists want to think about the kind of goods, life plans, and maybe future employment opportunities someone might have, whereas capabilitarians want to think about what you can really do and be at your present state. And lastly, I just want to leave you with a couple conclusions regarding the project as a whole. So even though this negative public opinion of cosmetic surgery persists in the present day, this industry can be truly transformative for patients experiencing a really negative psychosocial impact related to their appearance, and reimagining medical necessity through these kinds of lenses can help us to understand cosmetic surgery as a legitimate tool for improving health. And lastly, I just have my sources. Thank you so much.